Hi, my name is Shea, and I'm going to be telling you about oligodendrogliomas. Now, an oligodendroglioma is a specific type of brain tumor that occurs in the central nervous system and affects your oligodendrocytes. Your oligodendrocytes are some small cells that create the myelin sheath that protects your nerve cells in your brain. Now, something interesting about brain tumors in general is that rather than being staged, they are put into grades. Grade 1 is benign, grade 2 is slow growing, and grade 3 and 4 are both various stages of how fast it grows. For oligodendrogliomas, they are almost always grade 2 or 3, but they are never grade 1. If you have an oligodendroglioma, it is always cancerous. Once it is fast enough growing that it becomes a grade 3, it is also known as an anaplastic oligodendroglioma or an AOD. According to the NIH, generally these occur between the ages of 35 and 44. They are most common in adults, and they make up 3% of all the gliomas, and gliomas make up about 20% of all brain tumors in general. So they are the least likely form of glioma to occur, but they are also the most likely to have recurrence. This generally occurs in more likely for males and with white and non-Hispanic people. With my grandmother, I now find it a little funny that it occurred in her because she was a Spanish woman in her 50s. So she's outside of both of the main groups that it occurs in. The symptoms that you want to look out for are headaches, seizure, disorientation, problems with memory, problems with balance and movement, pretty much anything that's just out of the ordinary. If you notice your family member is starting to wobble a lot more, if they can't seem to focus, have issues remembering who you are, just most mental issues, it would be something to look out for. But these are symptoms that occur with almost every other form of brain tumor as well, so you won't know for sure if it's an oligodendroglioma until they get a scan or a biopsy. For my grandmother, the way that it was diagnosed is that my grandfather took her in to the doctor because he noticed something was just off about her. She wasn't acting right. And the doctor then they did a neuro eval to see what it was, just a quick little neuro test, then had some form of imaging. I believe hers was a PET scan. And once they had determined through the PET scan that it was in fact some form of tumor, they took her in for surgery and took a biopsy while they already had her cut open. And that's when they determined for sure that it was an oligodendroglioma. Treatments for this usually involve surgery because luckily with oligodendrogliomas, they are very centralized and have some pretty clear, well-defined margins. So with surgery, you can get most of it out without damaging too much of the healthy brain tissue. After surgery, they will usually want to do some form of radiation or chemotherapy. But in the worst of cases, you will go to palliative care. The first time that my grandmother got this, when I was a child, we did everything. They did the surgery, they put her on some chemo drugs, did some radiation, everything they could to ensure that she would survive for longer. The second time she got it, however, it was so far progressed and she told us she was done. She didn't want to fight. So we put her into palliative care and they estimated she would have maybe a month left. She passed 2 weeks later. The general prognosis, according to cancer.gov, is a 74.1% chance of surviving 5 years, which for how aggressive this tumor is pretty good. That's a pretty good prognosis. Recurrence usually occurs within 2 to 10 years, according to Oligonation, which is a wonderful group and has some amazing information and really good support for the families of people suffering from oligodendrogliomas. With my grandmother, we got very lucky and we had 14 years with her before it recurred. Something that is particularly scary and really important to know when you're looking at these is that when they recur, you don't always notice. You're still on the lookout for it because you are afraid of it, and you'll take them in every year or every 2 years for some new scans, making sure it doesn't happen. But you don't notice the symptoms. Most of the time, if they are doing a surgery, they will accidentally remove some good tissue. It's really hard not to, especially with the brain. So with my grandmother specifically, she would have really good days when she was all there, totally with it, could have amazing conversations. But she'd also have really bad days when she wouldn't recognize us. She would have trouble walking, she'd be incontinent, just all around really bad days. Near the end of her life, she hadn't had a good day in about 2 months. And a week before she passed, she had a really, really good day. And I will treasure that forever. But it is something very important to know when you are talking about these, because it is very hard to know when they are new symptoms of a tumor that is recurring versus lasting symptoms of part of their brain being missing. And I hope you guys are well informed from this, and thanks for listening.